Good evening, everybody. My name is Ajay Malhotra. I'm the Associate Medical Director of our Level 1 Trauma Center. And I join everyone in welcoming you and thanking you for all the support you provide to our trauma program. For the final, excuse me, for the final presentation each year, we chose a story of a patient who truly exemplifies that it takes a team to bring a person who has been badly injured back to normal life. And today's story is no different about a young man who was truly caught at a wrong place at the wrong time. Without further ado, the Chris Baker story that will be presented by Dr. Michael Abutanos.
In a neighborhood known for its peace and quiet, amidst neighbors who live easily beside each other, a young man of great promise faced a moment of horror that would change his life forever. This is the story of Chris Baker, a young, courageous, and decent young man who survived the tragedy with the unlimited and unconditional support of his family. This is also the story of a community of shining knights, professionals who seamlessly blended together their extraordinary skills to transform a man on the edge of life into a healthy college student with a bright future. On August 15, 2007, Chris's extraordinary story began.
Chris and two of his friends were going to go to the store. And so one was in the house getting money from his father. Chris was driving and his friend was in the passenger side. And the gunman approached the passenger window and he told him to get out. And I think they were trying to outsmart the gunman by saying, okay, okay. But then Chris tried to start the car to get away. And so the passenger, he gets hit in the head with the gun. And I believe from that, the gun went off because it went through Chris's right side.
Oh, man.
We responded code 3, arrived on scene to find the gentleman lying on the ground with the HPD officer trying to cut away some of his clothes, obvious blood to his abdomen.
I got the phone call, and it was from Chris's friend, and he mentioned that Chris was shot. And so I didn't tell Grace. I said, we need to go.
First thing we did is get him out of that environment. Even though you have police there to control the environment, it still can become unsafe. So we got him out of there, got him in what we call our office, the back of the ambulance. One person's doing a detailed assessment on it, checking for further injuries, other person's starting IV.
Bullets tend to tumble as they go through the body, so a bullet that goes in his left lower quadrant could have ended up anywhere. His ended up going down towards his hip. As we found out later at the hospital, at the time, we had no idea of knowing where that bullet was actually going to end up.
I just didn't know what to say because I didn't know what kind of shape he was in, and I was just in disbelief. I mean, here it is. He just gone to orientation to start school the next week, and now he's, with a gunshot wound.
He was all in all stable at that time. He definitely had injury to his lower left quadrant of his abdomen. So we started 2 large bore IVs on him, gave him some oxygen. He vomited a couple times. We did some suctioning. Any major motor vehicle accident, any type of gunshot burn, anything of that nature, we were going to VCU. No thoughts about it.
The next 24 hours proved to be critical. He has lost significant amount of blood. He's cold and unable to form blood clot. Intensive resuscitation and warming is carried out by the surgery trauma ICU nurses Preston Durant and Kwame Boateng. His intestines continue to swell. His pressure in his abdomen rises to critical level. Chris is unable to deliver blood to his vital organs. He needed another emergency operation. There's no time to take Chris back to the operating room. Dr. Merrill performs the operation at the bedside to release the abdominal pressure and stabilize Chris's condition. The surgery trauma ICU team of nurses, physicians, respiratory therapists, and pharmacists under the leadership of critical care intensivist Dr. Julie McLaughlin work around the clock to correct his bleeding, resuscitate, and stabilize him. With his abdomen still open, many more surgeries will be necessary. Chris is at great risk to developing infection and organ failures.
The traumas come in through the door and are transferred onto our stretcher, and our initial assessment begins. The team kind of descends upon them, everybody with their own job, mine being putting the patient on the monitor, talking to them, letting them know what's going on. We're putting IVs in, we're getting lab work. Especially with the gunshot wounds, it's just a small hole in the outside, but they can do so much damage internally, things that we aren't able to see at the bedside. So we rely on our vital signs. We're looking at his heart rate. Is it too fast? Is it too slow? His blood pressure, a sign that he could be bleeding out, his blood pressure starting to drop.
We certainly could tell by the trajectory of this bullet that it went across things that could be fatal if damaged by such a projectile. So lose no time. Where is he right now with blood loss, and then how quickly do we need to get on to the operating room in order to stop the spillage, in order to stop the bleeding?
He was shot, it's basically one shot, single shot. He was shot in his belly on the right side. The bullet went from the right to the left and lodged in his hip.
You feeling his skin, looking at him. Is he responding to us like he did when he first arrived? Has he stopped talking to us? Is he, sweaty and diaphoretic? Or does he look calm and relaxed? Those are big signs that we can tell if there's something serious going on inside, just those little outside things.
Looked like something simple on the outside. It was something very devastating on the inside. This bullet went right through his large bowel on the right side, went through about 35 centimeters of small bowels, multiple holes. There were about 6 holes in the small bowel. Went through his large bowel on the left side.
So we're following protocol, but the thing that overlays that is, what does this young man need now so that we don't get into trouble or lose the opportunity to reverse what looked like a really bad situation. And as I recall, the most impressive and urgent thing was a laceration to the left iliac vein that was just pouring a lot of blood. And so we had our packs in place. We got a good, careful, controlled look at that. So what was going through my mind is, if we don't control that iliac vein, you can exsanguinate, lose everything in a matter of minutes.
I walked into a typical scene that we see, a young kid who's been shot and who we did what we call damage control. Basically, my partner did a great job just to save his life, stop the damage.
Because we're a team, you have time periods when it's your responsibility and you must be at your very, very best then. The senior surgery resident is a very competent young man. And then over the anesthesia side, there would have been a senior anesthesiologist. We have nurses who know everything about this. They know everything. They know exactly what to do. It's automatic. There's not a matter of making a request. You don't have to spell it out. You hold out your hand and there it is.
The next 24 hours proved to be critical. He has lost significant amount of blood. He's cold and unable to form blood clot. Intensive resuscitation and warming is carried out by the surgery trauma ICU nurses Preston Durant and Kwame Boateng. His intestines continue to swell. His pressure in his abdomen rises to critical level. Chris is unable to deliver blood to his vital organs. He needed another emergency operation. There's no time to take Chris back to the operating room. Dr. Merrill performs the operation at the bedside to release the abdominal pressure and stabilize Chris's condition. The surgery trauma ICU team of nurses, physicians, respiratory therapists, and pharmacists under the leadership of critical care intensivist Dr. Julie McLaughlin work around the clock to correct his bleeding, resuscitate, and stabilize him. With his abdomen still open, many more surgeries will be necessary. Chris is at great risk to developing infection and organ failures.
First 24 hours, anything can really happen. You know, you can have some kind of internal bleeding somewhere, and everything is just happening so quick.
The nurse has been working on him for the past 12 hours or so. The process of what's going to take someone like him, this critical, and put him back together.
So I came in the morning, I received a report on an 18-year-old patient, young gentleman that came in, was severely very sick initially when I first saw him. When I went in the room and saw him, had received a lot of blood products through the middle of the night. And basically, honestly speaking, it's one of those patients that you just walk in the room and you really start doubting yourself, is this guy really gonna make it?
Chris had extensive wounds, so we had to do a lot of cleaning out of those wounds. He had multiple surgeries that he had to go through. He had some pretty bad bones that were broken, kind of really bad an injury in that hip. And initially, we had to kind of support him through all that. We had to support his airway, we had to support the fact that that bullet went in and the infection factors, so he was on a lot of antibiotics right from the get-go. You know, because when you get an injury like that, it's just not about the injury, it's about how it affects the entire body. And with Chris, we were really worried about infection because it's a foreign object, it goes in there and it really did some damage.
Hey Chris, Mom and Dad are here. They had to give him all this fluid because he'd lost body fluids. And so he was just swollen like the Michelin Man. So, I mean, just to see him, it's like his skin was going to pop. It was so tight. And it was almost like you didn't recognize him.
And he was hooked up to so much. You know, they had, I don't know what all the machines are, but all I saw was different machines and tubes, and we were preparing ourselves for the worst.
Chris was very lucky. He had an incredibly loving family, very concerned, very knowledgeable, knew exactly what questions to ask.
Dr. Abutanos would come, and he would always say to us, first, he's doing okay. You know, he would always reassure us. But my heart was in my mouth because I was like, how can this little guy survive this many surgeries? Because you know, they had to put his intestines back in. They had to live outside of his body for a while. And because of the swelling, they would have to just, little by little, every other day, try to get them back inside his body so that they could close him.
You know, we see this on a regular basis. We are used to this. We are used to seeing trauma patients. But there are some cases that it's a little bit extraordinary. And it's especially when they are that young and they are that innocent and they have so much, you know, potential in their life.
At this stage, Chris Baker has undergone 8 surgeries. August 23rd was particularly worrisome. His heart rate rises to the 150s. His fever climbs to 103 degrees Fahrenheit. In the next 3 days, his white blood cell count, which is an indicator for infection, will climb to a critical level of 43. Chris developed severe infection in his intestines and in his blood. Fluid cultures from the operating room show that the infection has spread to his hip where the bullet has lodged. Chris is septic. He's again fighting for his life. Walter and Grace brace for another roller coaster week. The daily vigils and intense praying continue. August 24th, Dr. Mark Willis from orthopedic surgery removes the bullet from his hip. Dr. Gordon Archer begins a long-term process of finding the right advanced antibiotics to fight off deadly infection. Dietitian Denal Italia devises a plan to ensure Chris has the nutrition he needs to stay strong. The ICU team continues the minute-by-minute critical care management until Chris slowly starts turning the corner. It's a gradual, painstaking process. Chris' relative youth and his strong family support give him a better-than-fighting chance. In the meantime, Chris is at long last taken off the breathing machine and can finally speak. For his parents, who have been holding vigil at his bedside, this brings indescribable joy.
The greatest joy is actually really when he was extubated off the breathing machine and able to say his first few words.
Pain, I know, was one of the frustrating things that he had to deal with. I remember while I was taking care of him, I tried to make sure that if what I gave him, if it didn't work, that we tried something else. And if that didn't work, then I needed to go talk to the doctor and find something to help him, because not only does he have multiple things wrong with him, but he's also got all this pain, and that just makes a person feel really bad when they have so much pain.
A lot of his issues, because of like the infection in his hip, we had to deal a lot with antibiotic therapy, getting a lot of treatment for the infections, also causing that to have issues with his mobility. So having physical therapy and occupational therapy, they were big parts of his care, just to get him to a place where he was physically able to be up and about.
As we saw him get better and he wanted to communicate with his friends, and we occasionally would let people come to see him because we didn't want to compromise anything. We'd come so far. He did have like 2 people that could come all the time, his best friend and his girlfriend. I think that kind of gave him the will that he wanted to come home.
Once moved to the progressive unit, begins the process of helping Chris literally get back on his feet. This includes physical therapist Rebecca Moran and occupational therapist Sarah Malone, who will help Chris regain his mobility. Nurses like Ashley Hoover help Chris with pain management, continuing to monitor the progress, fighting infections, working with physical therapy, and being a patient and family advocate. The team that's preparing Chris for his discharge home begins training Chris's parents to take care of him in the comfort of their own home. Now is the time for the emotional and psychological healing to start taking place. We are about to see Chris Baker smile again.
When I saw Chris, it was about a month since admission to the hospital. And the question for us was anxiety and possible post-traumatic stress disorder, which we call PTSD. He wasn't actually fearful. He was really able to talk about it. And this was a month after. But he indicated that he had 2 weeks of really not fear after the trauma, but more of an anger. And sometimes people present more with anger rather than fear. And it could be as impairing as fear and anxiety. So you need to address that.
I met Chris when he came to 11 West, so he was stable from the ICU, transferred to general floor. I met him and his mother around the same time. And my focus with Chris and his family was planning for discharge. It really was an interdisciplinary approach where we knew that he was going home, we knew he had complex needs, so we had people from every service we could think of at the meeting to make sure that any questions or concerns his family had got answered. We could really spell out for his family exactly what home health looks like at home.
I was like a deer in the headlights. Like, I don't know what to do, haven't done this. I remember them saying to us that we'll have someone to help you. There's someone to come over, they'll show you what to do, how to do it, and you'll be okay. And I think by just saying that you'll be okay or something to that effect, I felt comfort.
I mean, even though there was still going to be work here, but at least we were at home.
His recovery itself speaks really highly of who he is. I believe that just from talking to him, he's someone that has a strong sense of hope and have a lot of faith. And so I think with what he went through and coming out of it the way he came out, it was of no accidents. I think a lot of it is based on the fact of his faith and how willing he really is. He's one of those young kids that is very determined in life. So, when you have that kind of heart of determination, you can go through the valleys, but definitely, that heart can keep beating and get you over the mountains. So
it makes you feel so good to know that you had some part to play, and that something that you did made such a big difference, and that all the advocating that we do for them, that it's made a difference.
I'm just one very minute part of what took care of Chris. I mean, there are multiple nurses, multiple doctors, multiple therapists that were all involved in this care.
For us, it's extremely important, every patient that comes in, to really have that full team approach, because it is a head-to-toe approach. It's also emotional approach too. We want to make sure they're supported. Chris went through something that was pretty devastating, so we wanted to make sure those social and emotional issues too were well taken care of.
Family support is key. I mean, it's important for not only just physical help, having somebody when they go home, helping out, being able to support them, help take care of them, help them go to doctor's appointments, whatnot, but also just, mental support, emotional support.
There's a sense of incredible satisfaction, incredible pride when someone like him, move on and take this precious life and live it. That's what he has done. And it is amazing to see him again, amazing to see that smile.
We have him, we have him here. He has another chance at life. All the hopes and dreams that we had for him are still realizable. That's just huge.
I don't know how many people get another chance at life. And we have that. And we don't take that for granted.
Good-looking guy. Give him a round of applause. Altogether, Chris spent 2 months at VCU Medical Center, 2 months undergoing 10 separate surgeries. And I must tell you, as I stand out here, this is a wonderful scene from where I stand, because every single table out there is lit. It's like a table of light. And this is a room full of light, because this room full of very talented people brought one life back to light, back to us. During those 2 months and those 10 surgeries, Chris's family bonded with the healthcare team. a community of people dedicated to his well-being. They came together to share an extraordinary experience. This team, they put their training, their expertise, and compassion towards saving his life and helping him heal from his devastating wounds. These shining knights are compassionate, they're dedicated, they are fearless, they are tireless, they are unwavering, compassionate, and loving. Those are all my words, and words that each of us, I know, would agree that are perfect for this team, these shining knights tonight. This team is part of your VCU Medical Center trauma team. Are you ready to meet them? Are you ready to meet them? If I could ask John Duvall to come forward and Drs. Neifeld and Templeton up to our plaque area here, that would be spectacular, to hand out these wonderful tributes to our 24 shining knights. And what I would like for all of the help out here is when I read the name, it's a long walk from that seat to up here. So I want you to make sure that you make them comfortable. Give them a big round of applause. We're going to hoopla. This is a celebration, right? We've got a lot to celebrate here tonight from the past year and as we move forward. We've got the best trauma care specialists here right now. Are you ready? Yeah. All right. As I read our Shining Knight team, would you please come forward to accept your plaque? And then, I'm sorry, but you got to stand on the stage behind me for a little more recognition. We start off. Henrico Fire Paramedic Leroy Moore. Would you please come forward? Henrico Fire Paramedic Catherine Palmer. Henrico Fire EMT Corey Landrum. Emergency Department Physician Dr. Alvaro Zabelas. Emergency Department Nurse Tiffany Pitts Pignatello. Surgeon Dr. Ron Merrill. Anesthesiologist Dr. Linwood Stallings. Operating room technician Silas Shaw. Surgery trauma ICU nurse Kwame Boateng. Surgery trauma ICU nurse Preston Durant. Trauma intensivist Dr. Julie McLaughlin. Dietitian Dinaz Italia. Social worker Bridget Burns. Trauma care coordinator Rachel Poindexter. Unfortunately, she couldn't be with us. Occupational therapist Sarah Malone. Congratulations to her. Physical therapist Rebecca Moran. Psychiatrist Dr. Sharif Magid. Orthopedic surgeon Dr. Mark Willis, and his award tonight being accepted by the chairman of orthopedic surgery, Dr. Robert Adelar. Trauma nurse practitioner Lindsay Morales. Neurosciences nurse Teresa Alley. Neurosciences nurse Ashley Hoover. And finally, trauma surgeon Dr. Abu Tanis. Take a look, everybody, your shining knights. Is this the first time we've had the major reunion with everybody all together at the same time? So who's missing from the picture? Very good, Chris Baker. So I think if we applaud loud enough, Chris may come up here. Come on, Christopher. Is he good looking or what? Hey, Mom and Dad, you want to come on up too? Get up here. I'm not going to let you stand back there by yourself. Lots of hugs. And we want Mom and Dad to come up here and share this stage as well, because I'll tell you, just like our shining knights up here on stage, Chris is here because of the loving support that he had at home. Congratulations.
I just want to say thank you to everybody. Kind of a loss of words. I guess I was supposed to watch the video beforehand. But I'm just grateful to be here. Thank you for everybody. You know, little parts, big parts, everybody. I'm just glad to be here. Make y'all proud. Whatever it is I do in life, it'd be the right thing. Thank you.
Whatever he does in life, it'll be the right thing. We are guaranteed of that. What a beautiful family. This is a family here. This is a family. This is how we define it here with VCU Trauma Care. This is it. And thank you for bringing this to life. Thank you for being there for everyone. And thank all of you for being here as well this year and sharing this very special evening with our very special 24 Shining Knights.